Hey, and welcome to TMI Tuesdays with Lauren and Di. We're your new favorite physios, and we're here to give you the down low on down there, destigmatizing pelvic health one episode at a time. Welcome back to TMI Tuesdays with Lauren and Di. I'm Lauren.
And I'm Di.
We hope you're having a great week so far. Today, we are going to chat to you about something that we get asked a lot about. I think there's a lot of fear around this topic, similar to prolapse, and a lot of misconceptions. But we're going to chat to you about diastasis rectus abdominis, diastasis recti. Are there other terms for it?
DRA.
Yeah, abdominal separation. Yeah, so let's dive into it. Di's in her new place. Congrats, Di.
Thank you.
Moving in. Yeah, and I'm also in my bedroom, so change of scenery. Not that anyone cares about this, but just keeping it real. Okay, so let's chat about what is diastasis. So the definition of diastasis is a Latin term, and it means separation. So if you were to translate it word for word, diastasis means separation of the rectus abdominis, which is your large six-pack muscle. But even though it directly means that, there's a lot more to it than that.
Yeah, and so it's a separation up and down. So if you are thinking of your six-pack abs, it's from and it's not really a separation, but it's a thinning and a widening of the linea alba, which runs from the bottom of your ribs, kind of that like top of your diaphragm area that if you got hit in the solar plexus getting punched or getting elbowed in soccer, which happened a lot to me, that area that you get winded by, there all the way down past your belly button, down to the top of your pubic bone. That area is what widens in diastasis recti. And you can get it without being pregnant, but most of the time it's going to show up in people who are pregnant. And if you are going full term in your pregnancy, you're almost guaranteed to have some degree of diastasis recti.
Yeah, it's, upwards of 95 to 98% of pregnant individuals do get a diastasis, so a widening of the linea alba in their pregnancy. It's a normal adaptation that happens. So that's something we hear a lot. People come to us and they're like, I want to avoid this. It's unfortunately not avoidable. It makes sense. Baby is growing, your belly is growing, and so the abdominals do need to spread, and that linea alba needs to stretch in order to accommodate for that growth.
Yeah. And it's something that I think people used to be and maybe still are quite afraid of. I know when I started practicing, there was a lot of fear mongering and telling people not to reach too far behind them or twist too much during their pregnancy because they don't want to make it worse. And now we're not saying that anymore. We understand that this is happening to most people and it's not something that needs to be feared, and it's not something that unless you're doing something crazy extreme, you're going to be doing anything to make it worse during your pregnancy.
Mm-hmm. Yeah. There's still a lot we don't know. There is a lot of discussion around something called coning, tenting, doming, and there's different types of coning, tenting, doming. There's soft and then there's hard, which we can delve into a little bit more. And so there's some debate. Does that actually mean if you're doing things that cause coning, tenting, doming, is that making the diastasis worse? We don't really know. There's still debate, but I think generally our consensus is we want to avoid things that trigger that over and over again because it can be an indication of an increase in pressure in that separation. When the abs are coming apart and the linea alba is stretching, usually the doming, which is basically like a point or a tent in your midline. So most people feel it or see it when they go to try to sit up, to get out of bed, to get off the ground, or sometimes they'll notice it when they're doing exercises at the gym. A lot of overhead things or abdominal exercises can trigger it. And so there is some thought that coning or tenting is an increase in pressure in that area. And so that is a weaker area during pregnancy, but we don't actually know if those that really struggle with diastasis postpartum, if it's because of more stress and coning and tenting in that area.
Yeah. So if you're wondering if you have it, there's a few ways that you can check, or you might notice that coning or doming. I know a friend of mine she'd had two kids and she was pregnant with her third, and she used to notice it when she was at exercise classes, and then she started to notice it more in her third pregnancy quite early on, and she called it her alien baby. So she felt like there was pressure, like a little bit of bulging coming out just, I think hers was below, but either above or below her belly button, right along midline. And sometimes people notice it or their partners notice it when they're sitting up from bed. That's really the most common one that I hear from a day-to-day basis. So if you're noticing that doming or coning, that kind of pushing out of tissue right along midline, that might be an indication you have diastasis recti. And then there's a few ways that we can test it clinically. We can test it as physiotherapists, and then people can get ultrasounds. A lot of my patients haven't ever had to get an ultrasound, but that is an option for diagnosing as well.
Yeah. And when we're assessing for diastasis, what we're doing is not only are we checking for what we call the interrecti distance, so the space between your rectus abdominis muscles. So that's one way that we assess. And so we'll start with that. But there's a couple other things that we're looking at too. It's not just the distance between. So to measure interrecti distance, we start at the bottom of the sternum, so the bottom of your rib cage, and we put our fingers, usually starting with two fingers, right in the midline, and then we poke along the midline, and we're feeling for how many fingers we can fit between the rectus abdominis muscles. We usually do that with someone lying flat and then doing a little bit of a crunch and a curl up after and seeing how it changes. And so you can have different finger widths at different or different distances along the linea alba. So some people might find they can fit more fingers closer towards the rib cage. Some people it might be biggest or widest at the belly button, and some people it might be biggest or widest below the belly button. So it can vary based on the person. And so that's one thing we're looking at, and that's usually the one that you hear the most about and most people think is the most important. But
That's one that patients ask me about the most. They ask
yes.
how wide is it? How many fingers is it? Which also you have to take into consideration is subjective between practitioners. So if Lauren measures somebody, a patient, and she has say 2.5 finger widths that she measures, and I see that person, maybe it's even the same day, and I measure that person, well, my finger widths are going to be slightly different than Lauren. So maybe I'm at 3 finger widths or at 2 finger widths. So you have to kind of keep that in mind that this is a somewhat subjective measure between whoever is doing the testing on you.
Yeah, everyone has different widths of fingers. The conclusion is clinically that anything 2 fingers or less is insignificant, so normal, and anything greater than 2 finger widths is clinically relevant or a separation.
Have you done this test on yourself?
Yes, I have 2 fingers, and I
Yeah, I
get
do.
coning and tenting with planking, anything front loaded. So, and I've never been pregnant. So,
Right.
yeah.
And I don't know what mine actually is, but I would say it's between 1 and 2 finger widths. And I don't get any coning or tenting. I haven't checked with being pregnant, but pre-pregnancy, I've never had any issues. But just if people do this test on themselves and notice there is a gap or a space, that doesn't mean that they necessarily have a clinically significant diastasis recti or anything that we're worried about.
No, yeah, exactly. And just because, yeah, I have one now doesn't mean necessarily that I'm going to struggle postpartum either. So,
Exactly.
interrecti distance, that's one thing we look at, but we're also measuring depth of the separation. So, how deep can we palpate in between the linea alba? And this is giving us an idea of just general tensile strength through the abdominal wall or even thickness of some of those deeper abdominal muscles. So the thicker and more tense and tone there is in the muscles, the more resistance there'll be to you palpating. And so I usually measure based on my knuckles, like how deep I can palpate. So half a knuckle, first knuckle, between first and second. and second. And usually this is a great measure postpartum too, as we're building strength, because we want to see that depth get less and less as you're building thickness and tone and strength across the abdominal wall.
This is the one that I care more about as a practitioner. So when I'm assessing for width and depth, width, yes, it's something that we want to consider. Objectively, we'd love to see it get smaller over time. Doesn't necessarily need to happen, but the depth is what I care about most. I find that that functionally is going to give people a better outcome if they're able to decrease that depth. And you have to think about it in layers. So with your core, it's not just your six pack abs. You have other muscles involved in there too. So you have your obliques that let you twist, that are on a bit of an angle. And then you also have your transverse abdominis, which is a flatter muscle and it lays below the rectus abdominis. And so when we're pushing down, what we'd like to feel is that transverse abdominis giving you a bit of a bump back or support. And so personally, I'm more concerned about the depth than I am about the width.
Yeah, and I mean, I think it's important to consider both. I think there could be equal argument. I mean, when we engage our transverse abdominis, we actually see a widening of the interrecti distance. So this kind of argues against, the treatment for diastasis before was all about transverse abdominis exercises, right? And you shouldn't be doing crunches or sit-ups or higher level core strengthening. It was all about TA, TA, TA. And TA is super important, but that directly conflicts with, well, that's widening the gap by strengthening your TA. It isn't actually, but it may be increasing the tension and the resistance and decreasing the depth. So versus engaging your rectus abdominis is actually bringing the interrecti distance closer together. So working on more flexion type exercises, which were historically thought to be really bad, are actually really important for bringing that gap together. So we're actually doing all of it. The biggest thing is we want to actually strengthen all of your abdominal muscle.
I think of it like when we're talking, if we're jumping ahead to rehab here, if someone comes to us and says, okay, I have a diastasis recti, I want to work on it, these are the reasons why, great. So we can jump back to symptoms in a second, but let's just talk about what you do if you have it. So like Lauren said, we don't want to avoid crunches. We actually want to do them if they're well tolerated to you. So we want to think of it like you don't want to just do one thing. It's like if you are a soccer player, you don't want to really be good at only taking penalty shots. You also want to be good at all of the other things you have to do. Can you cross the ball? Can you run fast? Can you tackle? Can you dribble? Like all of these other things need to be in play as well. So you want to do flexion-based activities, so things like crunches. You want to work on coordination with your pelvic floor and your transverse abdominis. You also want to add rotational movement. So you want to add things like wood chops are great. And you want to start to pair those exercises together so that you're getting a really well-rounded core unit that's working cohesively together.
Yeah, I always say, there's no good or bad exercises because you go online, you're going to read and watch YouTube videos of so many different people saying, don't do this, don't do that, or diastasis safe exercises. And there are no diastasis safe exercises because two people with and we won't even call it necessarily diastasis, but just struggling to bring abdominal tone back postpartum, they're going to be at completely different levels, right? So they might have the same interrecti distance, they might have the same depth, but one person might be able to do more challenging core exercises than others. It depends on their connection, their coordination, their awareness. And what I mean by complete the exercise, but with an effective strategy. So are they generating what we call tension across the midline? So is their abdominal wall kind of coming in and up when they're engaging, or are they getting more distension out? So is the abdomen pushing out and up? And so it's not the exercise, it's making sure that you're effectively training your entire abdominal wall when you're doing that exercise. And if you don't know what to watch for or how to engage well, then yeah, you're doing core exercises, but you're not actually going to make any kind of aesthetic or functional changes in that abdominal wall.
It comes back to a very similar thing that we talked about in the prolapse episode, is that it's all about managing pressure. So within your abdominal cavity, how are you able to manage the pressure, that increase of pressure? So say pressure increases from something like a sneeze, or maybe it is a crunch or a sit up, or you're trying to sprint again and you need that core connection, or you're doing a heavy deadlift and you need that core to give you stability. We don't want to push just in one area. So you don't want to force all of the pressure forwards. You don't want to press all of the pressure down, again, especially if you're dealing with any prolapse or heaviness type symptoms or urinary incontinence. And if you have back pain, you don't want to push all of the pressure back. So it's finding strategies, working with ideally your physio or your kinesiologist, about how can you disperse that pressure appropriately so that you manage that pressure and not one area is overloaded, resulting in a weakness in that system overall.
Yeah, let's go through some examples of what that would look like or feel like. So, pressure out, that, like, say you sneezed or coughed or were lifting something heavy or doing a core exercise. An increase in pressure out would potentially look like your abdomen distending more. So, being pushed out. So we can see, yeah, coughing, it's almost like the abdomen's going out like that rather than engaging up and in. So that would be an example of pressure out. Pressure down.
Pressure down.
Yeah.
Is, again, cough or sneeze, and you feel heaviness, you feel leaking, you feel like something's falling out of your pelvic floor, either vaginally or rectally, and that's the increase in pressure down.
Yeah. Pressure back into the back would be tension or pain. So usually we'll feel, if we cough or sneeze, ooh, that makes my back seize up or makes my back uncomfortable. So those are all signs or symptoms of kind of poor or maybe not as effective pressure management in that whole system. So pressure is going too far one direction over the other.
Yeah, so this leads into symptoms. So that's one symptom that you might notice, is that you might notice that you're not able to control your midsection when you increase that pressure. So maybe you're seeing it, or maybe you're feeling like an outward push that's a little bit more than it was before. What else do you think some of the symptoms are that you see clients complain of?
The biggest one is aesthetic. So it's this
100%.
ongoing distension in their abdomen. So feeling like they're still 6 months, 9 months pregnant, that pooch, that pouch, sometimes that, the mummy tummy, or even, post C-section, that shelf. And that can be for a few different reasons, but that lower abdominal tone can contribute to it as well. So it's usually aesthetic. Some people do see an association with an increase in back pain, but it's not cause and effect. Just because you have diastasis doesn't mean you're going to have back pain, but sometimes we can see more, lumbopelvic dysfunction or discomfort with diastasis also.
I've had some people complain of not being able to generate as much power in their core when they are doing some of their higher activity exercises, especially if they're doing any heavy lifting or jumping or kind of powerful, forceful activities. That is something that people complain of. One of the things that I don't really ever hear personally is pain. And so when people do complain of pain to me, that actually pushes me to ask for an ultrasound for their doctor, because then I start worrying about a hernia. And so for
And you're
me,
talking
if I'm
about
treating
pain, you're talking about pain
in
in the abdomen. Yeah.
pain in the abdomen,
Right?
yes. So pain in the abdomen,
Yeah.
either around the belly button or above and below the belly button. And if someone's complaining of pain in that area, then that's something that for me is a bit of a flag to, okay, I've got these diastasis measurements with my hands. They're kind of subjective, but clinically we do track them. But that is when I send a note to their doctor and ask for further investigation, potentially an ultrasound, to see if there is a hernia there. And that's something that if you are experiencing pain and you're noticing kind of that separation, or you think you might have a diastasis, then that's worth checking out, because a hernia is something that we can also manage depending on the size of it. This is where a specialist would come into play, like being a surgeon, but Sometimes a hernia can actually also be managed conservatively, which means without surgery, but sometimes we do push people kind of the more surgical route for a variety of reasons. But that is one thing to keep in mind.
Yeah, that's a really good point. I find even sometimes there can be discomfort right in the solar plexus, and people think that that is related to diastasis. And I see sometimes it creates this loop of, oh, I have diastasis, I need to tense to close to hold everything in, and then that's actually causing more discomfort. So sometimes that can just be tension in that area. Also, we tend to hold a lot of stress and anxiety in our solar plexus too. So something.
And then when you're thinking about pregnancy as well, if you are getting pain kind of right at the bottom of your ribs, top of your abdominal cavity, if that's where you're getting pain in the solar plexus area, often during pregnancy, your ribs are spreading as well. And so some of that can be discomfort just from the ribs, the rib cage opening up to accommodate for pregnancy as well.
Especially if you were quite tense or rigid in your abdominal wall going into pregnancy. Like we find those that are very strong and have very developed rectus abdominis, sometimes they can get more of that sort of stretching, expanding discomfort in pregnancy. And that does not necessarily mean that they're going to have issues with diastasis postpartum.
Yeah.
Another
So we've talked a little.
another one I hear going along with that lack of being able to generate power in their core is also, I do core exercises and I never feel sore the next day. So they've never felt, no matter how many core exercises they're doing, that they feel like they're even turning those muscles on or challenging them. That's another common one that I hear too.
So those are the symptoms. In terms of treatment, we've talked a little bit about treatment from a conservative standpoint. So I think working with a pelvic floor physio is great. Come back to it. I use the Pilates reformer a lot for these people because we can change the way that their body is moving and use some different tools and try and get some different coordination patterns happening. So there's the emphasis is on conservative treatment to start. That being said, a large majority of people, and I would have to look at the statistics, I think it's about 45% of people who have a diastasis in pregnancy within a year postpartum are going to have that diastasis just naturally go back to within a normal value.
I think it's actually, as I've read, some as high as 8 weeks or as short of time as 8 weeks postpartum.
Yeah, and I think within that year, the percentage of people who have their diastasis resolved spontaneously without them really having to do much it climbs up to, I think, about that 35 to 45 percentile. It's great. Like that's really good news for anyone who's pregnant and is concerned about this.
Yeah. So, if you're 3 weeks postpartum and you're concerned about it, a lot of people have it naturally resolve even as soon as 8 weeks postpartum. And if you're still feeling, some of those symptoms at 8 weeks, don't panic, because just with some progressive strengthening and rehab in that area, up until, about a year postpartum, there's still so much room for improvement. And I don't want to say up until a year, because you can still make improvement after that. But it does take, for those that have really stretched out their abdominal wall and have got a lot of weakening there, it does take a good year to year and a half to progressively build that strength back. I always tell my clients this, I prepare them, I'm like, working on this diastasis is not an easy thing to do. I wish I could inject the strength in you, but it's like building muscle anywhere in your body. It takes consistency. It takes progressive overload, which means constantly, every 3 to 4 to 6 weeks, progressing your exercises and loading and challenging so that the muscles continue to get challenged and then can tear and repair and build strength. So, it takes a good year to year and a half for those that are quite weak postpartum in that area to build that tone back. So it can be done. Lots can be done around it, but it doesn't happen overnight sometimes.
Yeah. I prepare people for the same thing, year and a half. I say you might feel a difference, you might not see a difference for, 6 months. And so it's a lot of working on little building blocks to get stronger over time and feel more comfortable and more confident over time. But it is a process. That being said, If you have done all of the rehab and you are still satisfied with how your recovery is going, there are other surgical options that are quite a bit more invasive. So we'll talk a little bit about that. So the first thing to mention is that if you've had a C-section, some of the surgeons will actually stitch up between the pubic bone and the belly button. So sometimes you will notice that maybe you've had a C-section and you have a fairly big diastasis recti separation that is above your belly button, and it's really nothing below. And sometimes that's because of the surgeon who did your C-section. They were able to repair that diastasis recti in the C-section surgery. You see that as well, Lauren?
Mm-hmm. Yeah, quite often
Yeah.
actually. I think it
Yeah,
must
which is
be
great. I think
a
it's
code that they
wonderful.
can bill for.
Yeah,
Yeah,
my
definitely.
understanding is that in BC, they are not allowed to repair above the belly button for whatever reason, but they can repair below. So I'm always happy when I see it as long as the person's not getting any discomfort or scar tissue issues. But sometimes people will have a C-section and then they'll say it's feeling bumpy between my pubic bone, like above my C-section scar going up towards my belly button. What is that? It's feeling a bit lumpy or bumpy, or it's really sore in that area. And often, once you do an assessment, and then sometimes if you ask for as clinicians, if we ask for the OR report, then we can find out
Surgical
that yes,
ones.
they did surgery. Yeah, they did repair that. And then if that is not your case and you would like it to be repaired, there is an option to get it done as another option, and that's called an abdominoplasty. And so that is where they'll go in, and it's quite a big scar. So they usually go from hip bone to hip bone, just about. And then they are repairing that linea alba and bringing those two sides of the rectus abdominis muscle towards each other and together. And Lauren and I have both seen several patients like this. I've seen really good results personally. I think the one thing I would say is that people are surprised how hard the recovery is for the first 6 to 8 weeks and how much they need support for those weeks, and that it is not just a get the surgery and you feel better right away. It's a lot of rehab after that still, but long term, everyone who I've had have the surgery or I've seen that has had the surgery has been happy in the end.
Yeah, lots of swelling, lots of discomfort. You usually have to wear an abdominal compression for at least 6 weeks. It can be hard to sit, so most people need to take, again, like a full 6 weeks off of work. If you work at a desk, well, even if you work physically too, it can be challenging to sit. But yeah, great success rates. Those that I've assessed as early as 6 weeks post-op, already a huge difference in their ability to generate tension across their abdominal wall. And what I mean by that is when we're palpating, it's like, oh, we know there's muscle strengthening to be done, but it's like it's turning on. Like just bringing everything together creates this ability for these muscles to fire well in coordination. So yeah, people feel a big difference. They feel more solid, less hollow. That's something a lot of people describe too, is they just feel so hollow and like their core is non-existent. Unfortunately, in BC, this surgery is not covered by the medical system. So it is considered, unfortunately, a cosmetic procedure, which we feel strongly that it should not be. But
Yep, I agree.
if you do decide that you want to pursue it, you do have to pay out of pocket for it, which is really unfortunate because a lot of people would benefit from it a lot and do not have access to that. So that is something that hopefully we can advocate and lobby and change for in the future.
Totally agree.
Something I do see though also is rehabbing diastasis with an umbilical hernia. So umbilical hernias can be repaired by the healthcare system. And I find that, those that I've worked with that are struggling with both, they do really, really well with their rehab. We get them to a good point, but there's still this challenge of generating tension across the abdomen. They have improved things, they feel stronger, but aesthetically there's still this bit of distension. Just a small umbilical hernia repair can actually make a big difference for these people also, because if their diastasis isn't huge, they think it's still the diastasis is the issue because they still feel this distension and lack of tensile strength. But sometimes just repairing the hernia can make a big difference for people in terms of their ability to generate tension across the midline. Have you seen that as well?
Yeah, exactly. I've seen that exact thing. She was a really high, the person I'm thinking of, she was a very, very good accomplished skier, did a lot of backcountry skiing. And so, from a safety standpoint for her umbilical hernia, actually, we had to get it done because it wasn't safe for her to do backcountry stuff with the chance she could go septic. And so she had it done, but before that was also complaining of aesthetically and functionally feeling like she didn't have a really strong connection to her core postpartum after having her baby. And she'd done about a year of rehab and, super active person, super motivated, had done all of the right things, wasn't totally getting there, had just the umbilical hernia fixed and feels great. Has had no problems since. So definitely is a good option for people too if they're experiencing both of those.
The biggest thing we see is that people actually don't train their core enough, both in pregnancy and postpartum. Is one of the biggest contributors to diastasis is actually having excessive weakness in the abdominal wall. And so if you're not continuing to keep your core active in pregnancy, if you're not engaging your core well when you're doing functional things like picking up a toddler, say, while you're pregnant, those are all opportunities. Even getting off the couch, getting out of the car, getting out of a chair, those are all opportunities throughout your day to actually use your core and engage it well and keep it strong and functional. And so we see there's a lot of fear around, oh, I don't want to use my core because I don't want to make diastasis worse or get diastasis. But inherently by doing that, you are actually increasing more weakness. And there's a big misconception too around squishing the baby. Do you hear that a lot too? Oh, I don't want to engage my core
Yes.
because I don't want to squish the baby. Yeah.
Yeah, which is funny because my favorite core exercise to teach anyone who's pregnant is baby hug and baby lift, which is basically imagining the muscles of your abdomen hugging the baby, which essentially is squishing, quote unquote, squishing the baby, but it's hugging the baby. And when most people do it, they look smaller. So people think, oh my gosh, the baby is getting squished in there, which is not happening. And then we get them to do a hug and a lift. That's what I kind of start with people on, and I think it's great. And so, yeah, you often hear about people thinking they're going to squish the baby. You're not holding it long enough to cause any problems, and you're definitely not squishing the baby.
Yeah, there's just so much padding around the baby. Baby's in this fluid-filled sac, and baby actually really likes to be moved around also. So the deep breathing, contracting and relaxing your core is a great way to just keep baby in motion and active in the abdomen. So there is no documented concern with engaging the abdominal wall and doing that hug the baby motion. And I teach all my clients to do that during functional activities like hug the baby before you get off the couch, hug the baby before you get out of the car, hug the baby before you squat and pick up your toddler, hug the baby before you pick up a weight at the gym, hug the baby when you're doing bicep curls. Like just really trying to incorporate that connection to your core throughout so many different activities is a great way to keep your abdominal wall strong and functional, and then help you on the postpartum side. The less you lose in pregnancy, the easier it is to get back on the other side.
Exactly. So, yeah, totally agree. Very much advocate for people continuing core strengthening of all different types during pregnancy. And if you're concerned about what you should be doing, just talk to a healthcare provider, a physio who knows how to treat postpartum or peripartum people and people in pregnancy, and we will be able to guide you. I want to just give you a quick tidbit because I feel like we're kind of at the end of this chat. But I gave a talk a couple years ago to a group of bodybuilders, and we were talking about not diastasis, we were talking about pelvic floor dysfunction, I think, in general. And one of the ladies asks, well, okay, so we want to increase the diastasis recti space. We want to increase that space between our rectus abdominis muscle so that it looks better in photos. And I was so taken aback because I had never heard anyone ask for that ever. I feel like all the people that we see coming into the clinic, all they want is they want their core to cinch back together and to tighten up and not to have a space in midline. And it really gave me a double take because I was so surprised that anyone would ask for that. And it made me think about what my suggestions would be to that person. I'll see what you think about this. I'm kind of putting you on the spot here, Lauren, but I remember telling them that, I wouldn't try personally to increase that intra-abdominal space or into like between in basically to widen their linea alba, because we're trying to create strength and a really strong supportive core. And so we are trying to bring it back together. But I was thinking later about it, like that's such an interesting thing to think about. And I do wonder if in that community, if that's something that maybe they are working on. And that pushes me to wonder if that's something that they're working on and they're able to increase their strength still and be bodybuilders. Maybe that we're kind of wrong about how much a role that those muscles play in creating strength and across the linea alba and that connection to people's core. So I'm interested to hear kind of like what your reaction is to that, because it just totally caught me off guard when I did have someone ask that.
Yeah, super interesting. I would not know how to answer that. It's not something I've ever
No.
thought about. I don't know how you would do that with exercise alone. Um, I'm curious to look into it. And yeah, I mean, it makes a lot of sense because we know that in some people with diastasis, they do have some pain, they do have functional limitations, but in a lot don't. And the main concern for them is aesthetic, which I have no problem with, right? I think everybody should feel confident and happy in their body, but if they're feeling fine, they feel strong, they feel functional, they don't have pain, yeah, is it really as big of a problem as we think it is? And I guess that kind of argues that, again, that goes against our argument that the healthcare system should cover this surgery, right? And it's not just cosmetic. But I agree. I think there's a lot we still don't know about it. And I think we've made a lot of assumptions about it. But yeah, something to look more
Yeah.
into. I'm going to actually read a little bit more about that. I don't really understand how it makes you look better in pictures, but I'm going to deep dive.
I don't know either, but they were adamant that that's what they wanted to look like, and I was shocked.
Okay. Any bodybuilders out there? Let us know. I'd love to learn
Reach
more,
out,
honestly.
let us
I'm really
know.
just curious. No judgment. Just curious. Yeah. Awesome. Well, thanks so much for listening to another episode of TMI Tuesdays with Lauren and Di. We hope you enjoyed our chat on diastasis rectus abdominis. If you have any questions, feel free to reach out, email, DM us. If you have any concerns about your diastasis or how to maintain strength during pregnancy in your core and recover at postpartum, reach out to a pelvic floor physio. They can definitely help support you. So we hope you have a good rest of your week, and we look forward to seeing you again next Tuesday. Have a great rest of your day and keep it tight.
But not too tight.
See ya. Thanks for tuning in to TMI Tuesdays with Lauren and Di. We hope you laughed, learned, and didn't clench too hard. Please subscribe and share with your gals or guys who may need some pelvic floor love. We can't wait to hang with you again next Tuesday.